Good morning. I'm Maria Samini. I'm the director of the Rhode Island Office of Healthy Aging, and I'm so excited that you're joining us for a Medicare Monday. As you know, the Office of Healthy Aging has been hosting monthly Medicare Mondays to talk about Medicare, how it supports older adults, and help you learn more about a program that's so critical to your health and well-being, but can also be a little complicated. Today, I'm really excited that we have a special guest from our federal government partner. Everett Handford is the Region 1 Director of the U.S. Department of Health and Human Services of New England, and he is here today to talk about President Biden's Inflation Reduction Act. This really important act has incredible benefits to older adults, and we're really excited for him to share the news of the Inflation Reduction Act with us all so that we can learn how we can expect great things to come for seniors through the work of our federal partners. Everett, thank you for being here today.
Thank you so much, Maria. It's a pleasure to be with you all today. As Maria said, my name is Everett Handford, and I have the privilege to serve as the Region 1 Director of the U.S. Department of Health and Human Services of New England. Our regional office serves as a hub to hear and relay concerns that you may have for our Health and Human Services Secretary, Javier Becerra. Once again, Maria, thank you and the Rhode Island Office of Healthy Aging for affording me an opportunity to speak with you all this afternoon. Thank you to my remarkable colleague and partner, Ms. Jennifer Thoreau from the Administration of Children and Families, for also being with us here today. I would like to take an opportunity to briefly highlight and talk about a piece of legislation at a 20,000-foot view that you all should be familiar with, improving health equity for seniors across this nation. More than 5 million people with Medicare struggle to afford their prescription drugs. And we have heard from advocates such as yourselves who have shared stories of seniors and individuals forced to make difficult decisions to either pay for the medicine that they need or monthly utilities and food. We've heard stories that you have shared of people with disabilities who are left in financial ruins simply by trying to access the care that meets their basic needs. In August of 2022, our country took a significant step forward in our commitment to achieving health equity and delivering prosperity and progress to American families, thanks to the Biden-Harris administration and members of Congress who voted in favor to pass the Inflation Reduction Act. The Inflation Reduction Act is the biggest health reform initiative since the passage of the Affordable Care Act, and its benefits are already being felt by millions of Americans already. It is because of these efforts, Medicare beneficiaries across this nation will benefit from this act, and today I will walk you through some of the key health provisions included in this package. Next slide, please. Though it has a cascade of benefits, the Inflation Reduction Act does 3 essential things. The first is that it lowers Medicare prescription drug costs by placing a $35 out-of-pocket cap per month supply of each covered insulin picked up at the pharmacy or used with a pump. Secondly, it strengthens the Affordable Care Act by extending customers' savings on the marketplace an average of $800 per year on their premiums. And finally, it strengthens Medicaid and CHIP by guaranteeing adults in Medicaid will receive a CHIP, recommended vaccines at no charge. Over the course of the next 5 slides, I will go into more specifics of these 3 initiatives. Next slide, please. We all know that the Affordable Care Act made affordable health insurance readily available to more Americans, expanded the Medicaid program to cover all adults, and lowered healthcare costs in general. The IRA is certainly strengthening the general principles that make up the ACA. More than 16 million Americans signed up for marketplace coverage during the open enrollment period of 2022 and 2023. Of those 16 million Americans, 4 out of 5 individuals with a marketplace plan in 2022 had access to a plan of $10 or less after subsidies. Those customers who had access to a plan of $10 or less saved an average of $800 on their premiums in 2021 as a result of the American Rescue Plan. Without the IRA law in place, this would have ended at the end of 2022 and instead enhanced subsidies will now continue to be available until 2025. Next slide, please. The IRA is lowering prescription drug costs, and it's already having a positive impact on seniors and people with disabilities. As of January, Medicare Part D insulin copays are capped at $35 per month supply of each covered insulin. And starting in July of this year, the cap will also apply insulins with Medicare covered pumps. More than 1 million Medicare beneficiaries with diabetes will benefit from this $35 cap per month per covered prescription. Prior to the IRA, some people who take insulin paid as much as $400 a month for a single insulin product covered under their Medicare prescription drug plan. Had the IRA been in effect in 2022, 1.5 million Part D enrollees would have saved $734 million in insulin provisions. Also, as of January 1st, recommended vaccines are available to people with Medicare Part D at no cost to them. This includes the Tdap, whooping cough, pneumonia, and shingles vaccine, just to name a few. And for anyone who shelled out a few $100s on shingles vaccine, you know that this is welcoming news. And this coverage will also extend to most adults with coverage from Medicaid and CHIP beginning on October 1st. Next slide, please. The IRA lowers out-of-pocket costs. Starting in January of 2024, people with Medicare prescription drug coverage who fall into the catastrophic phase of the prescription drug benefit won't have to pay any coinsurance or co-payments during the phase for covered Medicare prescription drugs. Starting in 2025, people with Medicare Part D won't pay any more than $2,000 out of pocket for prescription drugs and will have the option to pay out-of-pocket Part D costs and monthly amounts spread over the year. Next slide, please. The IRA furthermore extends low-income subsidies. Individuals with Medicare Part D who have low income will benefit from expanded financial help with prescription drug cost sharing and premiums. The low-income subsidy program under Medicare Part D will be fully available to certain people with Medicare and limited resources who earn less than 150% of the federal poverty level starting in 2024. Drug manufacturers will be required to pay a rebate if Part D drug increases faster than the rate of inflation over a 12-month period. The Part D inflation rebate for 12-month periods began October 1st of 2022 and will go until October 1st of 2023 and must be invoiced by December 31st of 2025. Next slide, please. Finally, the last highlight the IRA accomplished is the negotiation of drug pricing. By September of this year, CMS will publish the first 10 Medicare Part D drugs selected for negotiations. The negotiated prices for all 10 of these drugs will be announced by September 1st of 2024, and the prices will be in effect starting in January of 2026. In the future, CMS will select 15 negotiations of 15 or more drugs for 2027 and 2028, and 20 more drugs for each year after that. In conclusion, through the IRA, the Biden-Harris administration and Secretary Javier Becerra of the U.S. Department of Health and Human Services are delivering on their promises to lower cost for American families so that people can access the care that they deserve and not have to make gut-wrenching decisions like foregoing medicines to keep food on the table. We are committed to equity and equal access, and I am so proud to be a part of an organization that puts families first. This concludes my presentation. Thank you, Maria, for affording me the opportunity to highlight the Inflation Reduction Act. I will leave my contact information in the chat box, and if anyone has any questions, please feel free to send me an email and I will get you the answers to all of your inquiries. On behalf of Secretary Javier Becerra and the U.S. Department of Health and Human Services, thank you.
Thank you, Everett, for that really wonderful information about the Inflation Reduction Act. It's always really exciting to have our federal partners work with us as a state agency to ensure that we're getting important information to the community. And I'm so excited that Kim, your usual Medicare Monday host, is with us and was able to hear that presentation as well. Kim, it was so interesting to me to know about the, excuse me, about the diabetes, the insulin cap. I know my dad was diabetic, my grandmother was diabetic. That kind of insulin cap will be really impactful for not just older adults, but anyone who receives Medicare who is insulin dependent. What did you think?
Very, very good step in the Part D area for the individuals that are dependent on the insulin. I have personally seen very good impact on that for this year alone. Many people have actually prolonged their journey into the dreaded donut hole. So it's really good to have these different cost reductions for the individuals.
So you've
and
seen it
others.
already? You've seen it
Yes,
already?
most definitely.
That's incredible. So often like new federal laws pass and it just feels like something that's happening in Washington. But for you to have seen that, and you can work with SHIP counselors to be sure that people are making those decisions for themselves in light of this new information from the federal government.
Yeah, it's so even though it's hard to have the communication come down to where we see that cost savings in the Medicare.gov, we might see the original cost. And I have seen insulin cost $700-800. When you see it into the Medicare.gov, it's going to say $35. And
it's going to be incredible.
And I sit there and I actually, because I scratch my head, I'm like, oh, wait a minute, that can't be true. Oh, yes, it is. I forget about this new rule. And I'm like, yay, oh, all right, this is good news for you.
That's right. And as you said, it can be hard to see that information filter down, which is why these Medicare Mondays are so important, because now we're letting all the Rhode Islanders know about this insulin cap if that's something that they weren't familiar with. And I also learned about the free vaccinations. I know that in my mother's circle of friends, there have been folks who didn't get their shingles vaccine because it was so expensive. And now that'll be free too. It's really a great impact to seniors of all income levels, but especially to low income seniors.
Right. Yes, most definitely. We aim to help anybody and everybody that comes in through our door, number one. And number two, no question is too big and no question is too small.
So is there anything else that, I'm not the expert of Medicare as that you are and that our SHIP counselor friends are. Are there other things about Medicare Part D or about any Medicare that he mentioned that we want to be highlighting for Rhode Islanders right now? Or is it the insulin and the vaccines are so great, maybe we just leave it there?
I really want to point out the fact that by 2025, the fact that your out-of-pocket costs are going to be capped at $2,000 instead of fluctuating up and down. That is going to be a big relief to everybody.
So there's immediate benefit through the insulin cap, immediate benefit through the free vaccines, and then some things that we'll see some great benefit about in the next years to come.
Correct. I really, it looks very positive. Very positive.
Good. Well, thank you, Kim. Thanks for hosting Medicare Mondays each month. I know that they're so important to our community and for the team at the Office of Healthy Aging that oversees Medicare work, Kim and Christine and Jennifer and all of our SHIP partners throughout the state. We thank you for the work you do. And again, thank you to Everett for joining us today on a special Medicare Monday about President Biden's Inflation Reduction Act. See you next time.